Hi everyone, welcome to week 2 of your Pharmacy Career Planning 2 course. This week we are covering Chapter 10. Chapter 10 is about one of the largest growing areas of pharmacy, and that is specialty pharmacy. This particular area of pharmacy is kind of a combination of regular traditional community pharmacies along with a home infusion type pharmacy. There's a lot of expanded roles for pharmacists in this type of setting, mainly around clinical services and patient education. So the first thing you need to understand is what is specialty pharmacy. And a specialty drug is any prescription drug that requires special storage and handling, inventory management, a high level of patient monitoring, and more intense support than a traditional prescription drug. So the idea here is that our pharmacy staff that's working in a specialty pharmacy are doing more than just counting pills and dispensing medications. They are overseeing the medication management of the entire process. So from the patient, not just getting the drug, but also how they're using the drug and those types of things. So there's a couple of different scenarios. We could have an independent specialty pharmacy that's either privately owned or it's a community owned, operated by, like a hospital or a health system type of thing. Or we might have a mail order specialty pharmacy that's operated by your health plan, or maybe a wholesaler, a retail drug chain, any of those types of things. So a lot of our more common retail pharmacies like CVS and Walgreens have their own specialty pharmacy divisions. So the different drugs that typically fall into this are some of those biologic drugs that are for some sort of chronic condition, orphan drugs, which are drugs that are for those folks who are, maybe it's a condition that you don't see very often. So there's not a lot of medications out there to treat that condition. Those are what typically fall into that orphan drug category. Oral chemotherapy falls into this. And expensive types of vaccines fall into specialty drugs. So there's a lot of different things that come under this particular umbrella. When we think of a specialty pharmacy, obviously there's staff. So the pharmacists, the pharmacy technicians, and any support personnel are part of specialty pharmacy. But the inventory is going to be much different than in a regular pharmacy. It's very limited, very specialized. However, the design of the specialty pharmacy is going to be very similar to a retail pharmacy or a mail order pharmacy, just depending on, how it's set up. But it's going to have some of the very same things that you're going to see. Traditional equipment, traditional types of automation, and things like that. The filling process is a little bit different. There is a patient enrollment in a specialty pharmacy type of setting. Not every prescription is a specialty drug, obviously. So not every patient is going to need to utilize a specialty pharmacy. And then some of those things like, order entry, adjudication, all of those things are similar. But the dose scheduling is probably the most important piece. That's where the pharmacist gets involved. They make sure that the patient is taking the drug appropriately, that we've developed a care plan for that, that they are making sure that they are complying with that care plan and all of those types of things. Another piece of a specialty pharmacy in some cases is trying to ensure that the patient is got coverage for that. So benefit review is another important piece of specialty pharmacy, and that's something where you may be working as a technician in that particular area. And this helps that patient find the financial assistance that they may need for these drugs. Keep in mind, if they're specialty drugs, they may also be costing more, right? So this is going to kind of go through and look at, do they have coverage? Is their current plan providing coverage for this drug? If it's not, how can we get them coverage? What can we do to help them? So those are some of the things that you might see as a role for a pharmacy technician. And again, a lot of patient education, training that patient on how to take that medication and things like that. So as you go through this week's material, if you have any problems or questions, please make sure that you reach out to me, and have a great week.